Hello, hello, and welcome to Hygiene Elevated Conversations and Innovations. I am very excited for our guest today. This is Lindsay Lee. She is a registered dental hygienist as well as a registered nurse. So, we are going to talk about kind of why she has both of those credentials and her story. So, Lindsay, thank you for joining us this morning.
Thank you. Thank you so much for having me.
Yes. All right. So let's dive right in. Tell us about your journey as a dental hygienist and kind of what got you into a practice that offered Botox.
Okay, so I've been working with the same practice since 2009. I've been working with this amazing doctor. His name is Dr. Steichen, and he is always on the cutting edge of everything as far as technology, treatment methodologies, and he's a very comprehensive dentist. So, long story as short as I can make it, our office does evaluate patients for sleep apnea. We're really into aligning and correcting people's bites as far as checking for and managing their TMD. And one of the adjunct therapies for both of those conditions is calming down the masseter muscles so they're not clenching and grinding as intensely. And the treatment for that is injecting neuromodulators or something like Botox into the masseter muscles. So he started getting training to do that. And in New Mexico, dentists are allowed to administer neuromodulators. But once that product hit our floor, it was kind of like this organic, beautiful cascade of all of these new opportunities coming our way. So first, it was the staff asking, "Hey, can you inject us in for cosmetic purposes?" So he went and got extra training. He did multiple national trainings to be able to do this properly. And then our patients started to really want it. And it got to the point where he was like, I need another provider here in the practice that can take on these patients and manage these patients. And so one day he just went to the hygiene team and was like, does any one of the hygienists have any interest in going back to nursing school? And that was the very start of it. So I volunteered, and then the rest is history.
That's so, I don't want to say
Yeah,
crazy, but that's so unique because,
it is.
first, to have a doctor that wants to invest that much in the practice
Mhm.
and in his other providers is really
Yeah.
incredible. And it says a lot about him and the relationship that you guys clearly had. So I think that's incredible.
Yes, I got very, very lucky with the doctor that I ended up working with. And so he's absolutely the best, and he treats everybody in the staff that way. So I think they're all very, very happy too. So
So when you started working at this practice, did you ever think, or did you kind of have at some point like, oh, I wish I could do Botox when you would see
you
him do
know,
it?
so when I first started out in hygiene, I didn't even think that that was a possibility. I wasn't even that what my mindset wasn't even there. But when I saw him do it, I really did think it was so cool because then once we introduced it to our practice, of course, then you open up that knowledge gateway of like, and those questions of who else is doing this in the world, right? Like, so like nurses can do it, dentists can do it, and it was just really cool to see. And also on the pain management side, when you have patients that have chronic pain in their jaw joints and having migraines, and then there's this treatment that you're doing that is working when nothing else has, and it improves their quality of life. It was just one of those amazing moments where you're like, wow, this is really helping people. It's not just about wrinkle reduction. That's like the fun side effect, right? But a lot of our patients were just in so much chronic pain that that became their new baseline. And so having that like, to be able to experience being pain free again was like life changing. It was incredible.
Mm.
I think that's such a cool story. I'm still kind of blown away by that because, in my mind, at least here in Colorado, dental hygienists can't do Botox. It's something that we're really excited to one day maybe do. But I would have never thought to go the alternative route of being like, okay, well, we'll just wait our turn. But no, go back to school, get a different degree, and then bring it to the practice and be able to use it that way. That is such an incredible and unique way of approaching a problem that you would normally just sit down and wait for your turn. So absolutely incredible. Did you have any interest in kind of pursuing nursing prior to your doctor suggesting
I hadn't, no. I actually have been in dentistry for a long time, and I was a dental assistant for multiple years, and then worked up at the front desk, and then went back to dental hygiene school. It's been a long, long career in dentistry, so I've always loved dentistry. Um, and my father was a nurse, and he worked in the NICU. So I think at very early on, I was like, I'm not going to go into nursing ever. And then I went into dental hygiene. So it was crazy. And then, yeah, going to nursing school after dental hygiene school, I think was a really unique experience too, because it just made me so proud of our profession.
that? Absolutely. And I feel like we all kind of know the road through dental hygiene school, but when you were
Mhm.
going, excuse me, through nursing, were you still working at that time, or what did that look like for you as far as like the school and the coursework and also work?
Yeah, so it was kind of crazy a crazy time. For a year, it was pretty intense. So because, dental hygienists have the same prerequisites that nurses have, I was able to get into a program relatively quickly. So that kind of took a lot of the headache off, because a lot of the getting into nursing school is being able to do the prerequisites and making sure you have a strong enough grades, because it's no joke. Um, but at the time, I was working with Dr. Steichen very part-time. So I kind of transitioned more into more of the HR side and doing a lot of the practice management um, duties for him. And then as well as teaching part-time at the University of New Mexico, which was nice because I could do that remotely. So I was still working and juggling all of that. But I think because of going through hygiene school prior to nursing school, I had already gone through a professional health program. I already knew how difficult it was going to be. I had study habits developed. I knew what it was like to have an instructor look right over me while I'm doing something and testing out on my clinical skills. Like, it didn't bother me anymore. And so it was kind of funny to have that perspective. Like, I know this is the drill. I don't have to be nervous about it. I just got to do the work. And then seeing all the first timers, going through and how nervous they were. It was just kind of like, it was almost like my mama heart just like grew. I was like, it's gonna be okay, because I was the older one. I was 42 in nursing school. So I was definitely by far the oldest student. So, but it was a lot of work, but it's one of those things that you just have to do, because the other option is not doing it and not completing your goal or your dream, and that just isn't an option, right? So just have to do it.
Absolutely.
I love your drive, Lindsay. Like, it's not an option. No, failure's not an
It
option.
wasn't an option. Yeah. So we just have to do it. And definitely there were times where I was like over Christmas break, when I was out of school for like 1 week, and I was like, do I really want to do this? Like, it's really nice not to have all of this work for this 1 week, and then you snap out of it and you just do it. You're allowed to panic, right? You're allowed to panic a couple of times.
Now, tell us how long your program was, but also, um, you told me that your doctor sent multiple hygienists back to go to nursing
hmm
school, correct? So, how many hygienists did he in total send back to nursing school?
So there's two of us now. So when I did mine, so just to clarify, when I did mine, I went through an LPN program, because in New Mexico that was allowed, right? An LPN could inject neuromodulators. So I did a year program and got my LPN, and then our other nurse went to an RN program, and so now there's two of us. And her program, I believe, was about a year and a half.
That's so hygienists out there who are thinking like, oh, I wish we could do Botox. This is an alternative. A really, I think, creative
It is.
alternative. Um, I mean, if the investment in time is worth it, because I mean, especially, sorry, I'm going to do a tangent here. The
That's okay.
excitement
I love them.
of, yeah, the excitement of, um, what is that? Integration, medical integration. So having like
hmm
the hygiene background, having the dental background, even if Botox is not your thing, but having those backgrounds and being able to like marry those two professions, I think that's something really unique. Like no matter what.
It is. Yeah, it is something really unique, and it is because I get questions a lot on social media from other hygienists asking, is it worth it? And in my
Hmm.
situation, yes, but you have to really want it. It's definitely something that takes a lot of work. It's not like, you're doing a couple hours every night and just doing some side study thing. It's nursing school. It's a lot of work to go through to add a couple or one treatment modalities in your practice. However, if you have drive and there's other things that you want to do and incorporate into your practice and really integrate dental medicine as like a nice marriage in your practice, then it is worth it. And I do feel like it makes you a stronger clinician as a hygienist as well, because you're going back through pharmacology, you're learning about all the systemic diseases again, you're seeing patient care from a different perspective. Um, and so it does make you a stronger clinician too. So it's definitely not like, wow, that was totally a waste of time just to do Botox, but it was a real eye opener on um, all the things though dental hygienists should be doing and could be doing.
I
Yeah.
feel like school goes so quickly though that you're kind of just trying to get through it at the time when you're
Oh,
going through dental hygiene school.
oh
So I
yeah.
feel like everybody honestly should have a second round of those incredibly important classes, pharmacology, the
Yeah.
systemic diseases, like reminding yourself, hey, not just try to get through this exam, but remember, like, this is important. Like, you need to know
Yeah.
these things for patient care.
Hmm.
So I think that that's actually really, really great. And everybody should kind of at least have a refresher course every couple of years or something. How did your
Yeah.
role as a hygienist prior to going back to school and then being done with school and then administering Botox, how did that kind of set you up? Did you feel like you were pretty ready when it was time to start doing that based off of your background? Or do you think that your program
Yes.
as an LPN really made all the difference?
So not to knock the LPN program because nurses are learning so much, and like I now after seeing it firsthand, I'm like, everybody be nice to your nurse. If it looks like they're not doing enough, it's because they're actually doing too much. Like nurses, like bless all of you.
Mhm.
Um, but I did feel like my hygiene background gave me a very, very strong edge when I was learning aesthetic medicine. So of course, after nursing school, you take your NCLEX, you get your licensure, then you have to take a whole another like group of courses to be able to like safely and appropriately legally be able to inject Botox and fillers. So once I did those courses and kind of like having that comparison and contrasting alongside other students who have never really given injections toward or to someone's face, it my little dental hygiene heart, of course, was kind of like giggling on the inside. I was like, this is not making me nervous at all. I was like, give me all of the needles. I don't care. So the dental hygienists, I mean, they are absolutely made for this. So I really do hope in the future that legislation changes so hygienists will be able to do this because they are perfect for it. Not to mention, like, we have impeccable fine motor skills, tactile sensitivity. Our eyes are trained to see very fine detail because we measure things within the millimeter. We're also trained to inject people's faces. We're trained to touch and manipulate people's faces without being weirded out by it. We understand facial anatomy, I think, more than most professions. So I just think that when I was doing my aesthetics training, I think my learning curve was incredibly low because I just was able to pick it up so fast because I already had all of those skill sets thanks to the dental hygiene degree. So I think hygienists should be able to do this 1,000%.
Hands down, I'm wearing my Let Hygienist Do Botox
I
t-shirt
love it.
today
Oh,
I
for
I
love
this.
should
it.
have thought to do that.
I know.
um,
But it's
so how go ahead.
I was going to say, but I think if they changed the laws and hygienists went through the same aesthetics training that the nurses have to go through, like beyond their original licensure, I think they would be more than ready and equipped and able to do it safely and beautifully and have great results. So, I don't know, just want to put that out there.
Yeah. We can kind of jump to the legislative side of things and the legal side of
Hmm.
things. A question that just came to mind. Why is it legally, like within the description of nurses and their scope of practice, why is it that they can do Botox, but a hygienist that can do local anesthesia cannot do Botox?
So it it's so technical, but basically nurses in their scope of practice are allowed to inject medicine overarching, right? A neuromodulator or neurotoxin is considered like it's a medicine, right? So or a drug, so it's an injectable. And for our scope of practice, it is very specific that we are allowed to inject local anesthetic, period. That's it. We can't inject immunizations. We can't inject anything else, right? So that is why how our laws are written, it's very specific on what we can inject, not that we can just
Mhm.
inject whatever we want. Even if it was delegated from our doctor, we still can't do that. So that's kind of where we have our hands tied, so to say. But that doesn't mean things can't change because these are all written by people. They can be rewritten, right? And changed. And there are 3 states right now that are allowing dental hygienists to inject neuromodulators, which I think is fascinating. So, and one of them was just very recent last year. So there's change happening, and I think awareness and acknowledgement of how educated dental hygienists are, how skilled they are, and capable of doing this. And also, we have a huge, very long history of being very safe practitioners. You know, we have great rapport with our patients. We are not, there's not a lot of litigation against dental hygienists. We are just like perfect type A practitioners. So I think that we should be able to push forward and get this. And I think if everybody kind of bands together in their states and asks the people on their board and in their associations to consider this, I think there's going to be um, a lot of a lot more movement with it. But if the board doesn't know that the hygienists want this, or their association was just like, oh, we didn't know that people really cared about this, then they're not going to put their time and energy into it. So it has to come kind of from the ground up.
Yeah, and I think Nicole can definitely speak to this. That involvement, that piece that you just said, the involvement
Hmm.
in your local component, being a member of your association has so much more impact than what we, I think, sometimes perceive, especially for
Oh yeah,
things that like scope of practice. If hygienists don't have that support to have a good, what is that? I'm spacing the name of the person that lobbies for you, the
yeah,
lobbyist, then change can't happen. So I think a lot of
yeah,
hygienists just think, oh, if I just get this, if I get my dental hygiene career going, I don't have to worry about anything because, laws are there already. Instead of having the
oh
attitude
yeah,
that, okay, if I don't like something about how I practice, I can change it. Because as we know, every state is so different. And you and I are
hmm,
from New Mexico, and when I moved to Utah, I was honestly blown away by how restricted hygienists are here versus New Mexico, which
yeah,
seemed like it would be completely opposite. In New Mexico, hygienists can practice without a dentist on site. They can own
yeah.
practices. There's so much more
It's
freedom there than other
yes.
states, which honestly blows my mind. And I just kind of had to step back when I realized that, and I'm like, what is the difference here? And I think it does have a lot to do with the associations and how much say they have and how much support they have from their members.
It's true. And it's also like the association, every state has their own battles, right? So there might be different access to care issues, educational issues as far as like, do we have enough schools for dental hygienists? Do we have enough dental schools? So there's a lot that the association is doing. And I do agree, like When I was fresh out of school, we're told in school to sign up for your association
Hmm.
and be a part of it and know what's going on. And I have to admit, like, embarrassingly enough, I did not be a part of it. I kind of like, I was like, I need to go work. I need to make my money. I'm not going to pay those fees. And even though it was like less than a day of hygiene work, and I was like, I'm not going to pay that. And then now that I've been in the game for, over 2 decades, it's kind of funny how your perspective shifts and you're like, wow, it's not just about me, it's about the profession. And we do need people and numbers, not just because of the funding involved, but because we need those opinions. We need that buy-in, that say, and that the association needs to know what the hygienists actually want. And scope of practice is huge because
Hmm.
people think that just because we have it now, we're going to have it forever. And that is not true because I've seen where scopes of practice have, yeah, been advanced and broadened, which is wonderful, but I've also seen where it's been taken away. And that is devastating. You probably felt that when you went to a state that wasn't as progressive, maybe in your scope of practice. And it is kind of deflating being like, I have all of this education and these beautiful skill sets that I can't use. It's it it is very disheartening to be like I can do more than this and now I'm not allowed to. Um, so yeah, being a part of your association is huge because um, in New Mexico we're trying to see if we can broaden the scope of practice for dental hygienists. And until I got into nursing and started doing aesthetic medicine for my practice, I had no idea how many hygienists wanted to do it. It's incredible. Like I thought, oh, there's probably a handful of us. This is cool. But now on social media, I get asked about it all the time. Questions like, when can my state do this? Or how did you get to do this? I want to do this. And I was like, wow, okay, well, if there's so many of us, we need to say something because I had no idea. It was never brought up in hygiene school when I went because it wasn't even a thing.
No,
Yeah.
absolutely. I think that that's so true, and I'm just kind of curious, and you may not know the answer to this, but maybe at least for New Mexico, but is that like on the docket for legislation for you guys, or do you know of any other states that are right on the brink of this kind of becoming a reality for them?
So I know in New Mexico that it is. It is a big conversation. We just recently put out a survey to our hygienists asking whether or not this would be something that they would be interested in, and asked them other questions about what level of education do you think you need to be able to do this, additional training, what type of supervision. So we actually did a pretty extensive survey for our hygiene community to see the need. It is also something that the president of the NMDHA is kind of pushing. We have lobbyists that are working for us to help us push this through. I am the president-elect of NMDHA, so next year I'll be taking on the president role, which of course this is going to be something that I am going to support, which is great. But I really think that it's coming from a very well thought out perspective and position. It's not just we just want to willy-nilly throw these things into our scope of practice. Now that I've lived out the question and have contrasted like the nursing degree with the hygiene degree and incorporated into a practice to see if it's actually beneficial. I mean, is it actually helping our patients? Again, not just about the cosmetic side, but is it actually something that is good for our patients dentally? Now living it out for the last 3 years, it really is. And it's wonderful. So I can't speak for other states. I'm hoping that there is a lot of talk and buzz about it. Um, but I think that once, Arizona just passed last year, if New Mexico hopefully gets it, soon, then I think that just from those changes happening in certain states, that it'll inspire other states to get the ball rolling too.
Yeah. Do you know anything, Nicole, about Colorado? If it's something that's happening for you guys?
I think it's something that's being talked about, but I don't believe that it's something that's being like one of the number one things that they're kind of like trying
Yeah.
to get done right now. It was definitely talked about
Mhm.
at our yearly or annual meeting. Um, but I'm not 100% sure on that because I think there was a couple other pressing things that they're trying to get done first. So I think
Yeah.
that that's what they're focusing on,
Mhm.
but I do hope that it's coming in the future. I was listening to some other podcasts about some people over in like Massachusetts that were wanting to do it, and they got up and they were, giving their testimony, and the one person that stood up in disagreement was a nurse. And the nurse said, "You guys don't have any, background in head and neck anatomy. You don't have enough studies in this. You don't have any education in what it takes to inject somebody around the face." And I think everyone just in that room looked at her and was like, "Oh boy, you didn't come with anything backed up, did you?" Because then
Yeah, you had no
they
receipts.
yeah, because then they went back at
Yeah.
her and yeah. So I don't know. I've been hearing it about other states. Not too sure about Colorado right now, but I think in general there's so much on the horizon, and I think just the overall, amount of people that are starting to learn about what the association does, the more that we're putting this out there, the scope of practice is becoming bigger and better simply with your support of the association. That is what is, I
Mhm.
think, starting the ball rolling. Social
Mhm.
media in the last 5 years or so has really put so much light on all of these different subjects and how important they can be, how you can incorporate them, and why we need to get these things at least to have options. And my thing always is with my patients is, you may not like this option, but let me give you 5 others to try, because everybody's so different and everybody needs those options to at
Mhm.
least choose and have
Mhm.
autonomy for themselves as well. So, kind of getting away from the legislation portion, how did you start to incorporate this once you finished your degree, once you finished your training for Botox? You're now back in your office with your awesome doctor who supported you and suggested this. What did those first couple of weeks look like?
So it was making sure that we can still stay busy enough for me to do this full time, right? And so even though we had a good patient base, there was more to gain, right? We needed to make sure that we are letting people know that we do this treatment modality for chronic pain management, bruxism, as well as cosmetics. So because it was also an aesthetic component, we kind of had to change our game and make sure that when we were talking to our patients about it or marketing and having that awareness, that we were like, hey, we do both. Like, don't get confused. We're still a dental office, but now we have aesthetic medicine as well. And then, like you were talking about social media in the last 5 years, um, I did not have an Instagram before that. I was one of those girls that had Facebook just to see my little nieces and nephews that live in different states. I wasn't very active on social media. And then I had to get really aware of how to use it, how to work it, and then just to have that awareness. So that's what I did. I spent a lot of time with my marketing and making sure that patients were aware of that and understanding the importance of like before and after photos, documentation, showing the work, and that it was a lot of building. So that first couple weeks was like planning, how am I going to do this? How are we going to get more patients to support this side of the practice? Because my doctor basically was like, you can make this as big as you want. I'm going to give you the freedom to do that, but you need to build it, be busy, and do all that because if we don't have patients in the chair, then we need to reevaluate, right? Because it's a cost benefit analysis too. So it's a business as well. But that's what I did. And so you really had to get out there and talk about it and be more, create more awareness. So I just had to play the social media game quite a bit to build those clients. And then you get referrals, and then patients are, when they're like, why is a dental hygienist or a dental office doing this? And it's like, well, if you think about it, who better should do this for you? Like with all of our facial anatomy education and all of our experiences and our training in aesthetic medicine, now that I had incorporated, I was like, you're in an environment that is sterile, is clean, has a medical provider on staff. There is a dentist right next door. You have a person to call directly if anything goes wrong. Um, and so they're in a very safe environment. And I've had multiple patients say like, wow, now that I've been here and thought about it, because they had been to other places too, like they said, like, I would never go anywhere else other than somebody from a dental office because just of how how much we just follow all the rules. Like everything is clean, everything is sterile. We don't double use anything. There's such, like we're big on like not cross contaminating. I told her, I was like, all of our products come directly from the manufacturer. We're not buying stuff like,
Mhm.
on the black market just to save a buck. And what was really nice is that we were able to provide all of these wonderful high quality products because we had another business going too. The dental office, they were kind of supporting each other. So it was really great.
That's so cool. Yeah, I actually and the esthetician that I go to for facials and stuff like that, she actually works out of an orthodontist office. She has her own little suite in there,
Oh,
and she does Botox, and her employees all do Botox. But they're I don't think any of them are nurses. They're just estheticians, but they not just estheticians. I didn't mean that. They do beautiful things too. But I'm just saying in general, like they have the orthodontist that comes in and double checks everything that they're doing. They trained under him. So it's just it is I feel a lot better, being in that environment because I feel like I trust, what he has to say. But can you kind of speak on like so I don't know how it is, do you guys need to be under a doctor now as an LPN or could you open your own, place and administer Botox?
Let's see. Sorry, my computer's lagging here a little bit.
Oh,
It's
it's
just trying to get it situated. Can you guys see me now?
okay. Hmm.
yeah.
Okay. Sorry, it was like freezing and I'm like, I don't know what's going on. Sorry.
Technology.
So the question was, yes, it's wonderful and beautiful at the same time. So the question was, can an
Just whether or
LPN?
not can you do this on your own, or do you have to be working under a dentist or a doctor, or as an LPN, can you administer this at your own discretion?
So no, so we do have to have a medical provider, an RN or an LPN, regardless. We do have to have a medical director basically say and approve what we're doing. Unless you're a nurse practitioner and then you can be your own medical provider. But so we do have to have a dentist on site, basically saying like, yes, we approve this treatment, just like with any hygiene treatment, right? Like before we do, scaling and root planing and things like that, the dentist is, technically supposed to say like, yes, this is what we agree. We are diagnosing periodontal disease. We are saying that they need non-surgical periodontal therapy. So it's the same with any treatment. So we do have to have that like thumbs up from the dentist or any medical provider if it's an MD or an NP.
I'm curious how this looks in practice, like your schedule as a hygienist. Is it like separate? Like, are you still doing RDH things? Are you still doing prophies, SRPs, that sort of thing? Or are you pretty much strictly on the neuromodulator side of the schedule? How does it look in your practice?
So in my practice now, just because of how everything has evolved, I do bounce in and help with the hygiene team as needed, right? Like if they're running behind or if somebody needs to sneak out of the office or they have the day off. So I'm always helping fill in hygiene. So I haven't necessarily given that up, but it's definitely less now as things are getting busier. Our other nurse injector slash hygienist has kind of like a full day of just injectables and she'll bounce back and forth too, but she's kind of separated her schedule as doing injectables a couple of days and then hygiene a couple of days. And then for me, I kind of fill in as needed. I also am the practice manager, so there's a lot to do. So I am now kind of
Oh,
shifting out of injectables and I'm doing a lot of the like laser therapies, the microneedling, and then I help her and I do that, and then I help in the hygiene department too. So now I'm kind of like working all three departments just to make sure that the flow is nice and letting Christina, she's doing most of the injectables now just because of how our office flow is going, which is really great because now her practice is getting really busy.
Do you find that you're the one that's kind of approaching the patient saying, "Hey, I notice you have some TMD, some stuff going on. I think that, Botox would really be helpful." Or do you think because you've kind of become established as a place that does neuromodulators that people are more coming to you saying, "Hey, I want this."
I'm sorry, my something is wrong with the internet again. I am trying to move you guys. It's
oh,
so embarrassing.
You're totally okay.
the audio is staying up, so usually it's the video is fine, so don't freak out with it.
You're good.
Okay, well, I'm trying to like move things and plug stuff in and see if it can. So I'm so sorry about that.
You're good.
Okay, it's like not, I don't know what's happening on my end. I'm sorry.
That's okay. Can you hear us okay, or is it just kind of slow?
I can, no, I can hear you guys okay.
Okay.
Okay. Um,
Okay, so sorry, will you please repeat that last question?
yeah, go for
Yeah,
it.
no, I was just kind of curious, is this something that you're approaching patients and being like, "Hey, I notice you have, TMD or this, these neuron modulators would really help you with this," or are you guys kind of established enough to where people in the community know that you do these things and they're more now approaching you saying, "Hey, I want this done."
Yeah, so now that there's that more awareness, people are asking and commenting about it and definitely reaching out more. And like I said, on social media, which is really great, like, hey, can you do this? Or I saw this um, on another person's platform. Do you guys incorporate that into your office? So now definitely it's like the business is organically growing because of word of mouth, and people are seeing some of the before and afters on the aesthetic side or reporting how good they feel when they're coming in for chronic pain. So it's been really nice to have that referral source. But yeah, people are just kind of starting to like naturally find us, and it's wonderful.
That's so cool. So will you see people just for aesthetics, or do all of your patients that you're injecting do they need to be established dental patients prior?
So they don't have to be established dental patients prior. So they can come just for aesthetics, they can come just for the chronic pain management, or they can do both. They can be a dental patient and an aesthetics patient. So a lot of our initial patients, though, were dental patients originally, and when they found out that we were doing this, they started coming to the practice for that as well. But then we have some that just come to the practice for, it's kind of funny because they come just to the practice for aesthetics, but then they have another dentist, and we try to be, we're always very professional. We're not trying to take patients from anybody. So it's kind of a blend of both.
Interesting. Sorry, I just thought of all these like questions as we were talking. So sorry. I was just
You're
other question
That's
too.
okay.
Is there any kind of
That's
insurance
okay.
reimbursement on Botox at all?
So in the medical field, there is, if you go to a neurologist and you are able to get it approved, I believe that there is some reimbursement medically. We in our office don't take it just because of the type of provider that's injecting it, and so it's just a fee for service. I'm hoping though in the future, what I foresee the likeliest possible scenario happening is that if dental hygienists are able to inject neuromodulators in the future in more states and it becomes a more widely used treatment, I do feel like eventually down the road, and this is going to be years and years, but down the road that the insurance companies might acknowledge this procedure and hopefully start to cover it for the purposes of chronic pain, like TMD related issues. So I'm hoping that in the future that'll happen, but right now it's not there at all. And in the medical field, you can, but again, it's for very specific types of injections, and you have to have a certain type of provider approve those treatments. Um, and I even have patients that come back to me that do get it covered, but they said that their person that injects it is only allowed to inject certain points in their face, and they will not do other areas like if they're clenching and grinding and they have headaches, their provider is allowed to do injections here to get rid of their headaches and along their forehead line, but they don't inject their masseters. So they come to me just to get their masseters and their deep masseters injected. It's kind of funny how it doesn't overlap, but that's it's like a yes and no. So there is coverage, but it is very tricky to get.
insurance. The
Yes,
re-
insurance. We deal with it a lot in dentistry too. I just wish that it was one of those things where we could just say, this is what we're doing. Please help our patients afford it. But that's just, you know,
yes,
it's helpful, but it doesn't cover everything, right?
not even close. Um,
Yeah.
okay, I have one more follow-up question and then we'll close with our last two questions. But With
Okay.
the implementation of the injectables into your practice, I'm curious, who does the treatment planning? And is that something that you, as the LPN, are able to do and then execute it? Or is that something that your medical provider, well, not medical provider, but your provider has to
Yeah.
treatment plan and then you're able to do the treatment plan?
So basically what happens, it's very similar what happens in the hygiene room, right? Where I think a lot of hygienists, what they do is they kind of set the doctor up and say, these are, I think, what the recommendations that the doctor is going to say, like, or you need a crown on, it looks like you have something going on number 14. It could possibly be a filling. It could possibly be a crown. We kind of set that up for the patient.
Mhm.
And then we bring the doctor in and the doctor usually confirms what we said, right? And approves it. And that's what happens really in our practice for the aesthetic side is that we address their issues, see what their end goal is. We tell them what the treatment options are, the dosing that it's going to be, and then the doctor will look it over and give it a thumbs up and say, yes, I agree with that, or no, let's add something here, or let's change this, or why don't we start at this area first. Um, but typically it's we set it up, we give our recommendation, and then we get approval from the doctor, and then we perform the treatment. So it's kind of it's a very, very simple flow. It's just like a hygiene exam.
Yeah, no, which just makes sense why hygienists should be able to do this. If it just integrates
Yes.
so beautifully, why not? All right. Well, Lindsay, thank you so much. I feel like we probably could have asked you about 10,000 more questions.
Yes.
Yeah.
Like so many things, like just so many little things of legality, implementation, that sort of thing. But we do like to end our podcast asking the same two questions to all of our
Okay.
guests. So I'll take the first one. Nicole, if you want to take the last one.
You got it.
Okay. Well, Lindsay, if you could go back and give yourself a piece of advice, what would it be as a new grad?
Um, that's a really good question. So I think that the advice I would give myself is to trust something that one of my instructors said, and her name was Nora, and I talk about her almost in every single presentation I've ever done. But she told me, she was like, make sure you find a dentist that you work with and not for.
Mm,
And I didn't, I like, I knew what that meant, but now that I've lived it and I've worked part-time for, other dentists too, because most hygienists work Monday through Thursday, and that's what I was doing with Dr. Steichen. And then I would pick up Friday jobs. So I have a basis of comparison. That in itself has changed my career because it not only was finding a dentist that treated me well, but I understood that having that perspective that I need to work with him or her, it mentally gave me this different perspective that I had buy-in in the practice. I was part of that team. I was part of his dream because this is also his job too. This is his whole career. And I'm a big part of it because I'm one of his hygienists. And so realizing that I'm working with somebody and having that perspective and treating it as such, like it's a partnership, I think made me want to enjoy my job more, invest in it more. Um, and I think I was then later viewed as more of a collaborative employee and somebody that is like, I'm going to be there forever, right? And that's kind of how I treated my job.
I love that. I think that's a super powerful statement because so many people get stuck in these toxic work environments and think that they
that,
can't get out of it. And
yes.
they think that,
Right.
they're just there to collect a check. And it's when you collaborate with the doctors and, the other hygienists that you work with that you come to this beautiful place. So I think that that's a really great piece of advice. So our last
Hmm.
question is what do you wish you would have learned in school that took you years to learn as a hygienist?
How to administer Botox because I had to go back to nursing school for it. No.
Okay, I mean, valid
Um,
answer.
no, that was more of a joke. But
Obviously.
as far, yeah, obviously. In hygiene school, what do I wish? So this is something that I do feel that would have been really beneficial that I had a little bit of perspective on because I was a dental assistant before. Um, I do think that is incredibly invaluable or valuable for hygienists to understand what everybody else in that office is doing. Um, I think that because of being an assistant prior, I did have a perspective of valuing those assistants and working up at the front desk prior. I understood that that job was super hard because I actually did that job thinking like I don't want to work as a dental assistant anymore. I want to go to the front desk and have that easy, cushy job where I can eat my oatmeal and just talk to people all day. And that's actually the job that inspired me to go back to dental hygiene school. I was like, I need to get back to the back. I was like, this is the hardest job in the whole practice. So hug your front desk person, hug your assistants. Um, because everybody's job is hard in different ways. No one has an easy job in a dental practice. And I think that maybe working a couple of days as those people might be really good for hygienists. And I think that just also, you know, helps foster that collaborative, I work with this team vibe. But that's I think honestly that would probably be it because dental hygienists, we learn so much. Like it is we have a lot. So I don't know if they could fit anything else in, honestly.
No,
Yeah.
it's so true. Well, Lindsay, you gave us just so much to think about and so much, I think, hope for where hygiene is going. And I think one of the things I love about our podcast is just being able to hear how other hygienists are practicing. And so I love your story. I love the work that you're doing, and I'm excited for you
Thank
as a
you.
future leader in the dental hygiene community.
Well, thank you guys so much for having me. It was yes. So and any help I can bring to the dental hygiene community to help advance our scope of practice and highlight how awesome we are, I'm here for it. So
If somebody wanted to reach out and ask a question, where is the best place that they can find you and contact you?
so probably Instagram has been honestly the best one. And my Instagram handle is aesthetic Lee. So my last name Lee and aesthetic with an A and then aesthetic Lee NM for New Mexico. So it's kind of a long one, but that's where I get a lot of questions regarding hygiene, scope of practice, the nursing combo, Botox, and then in the future you'll probably see me a lot on a platform called Clinicians Platform because I'm going to be co-developing a continuing ed platform for dental hygienists specifically, and it's all going to focus on scope of practice advancement. So either like strengthening your clinical skills that you have now, and how do you incorporate other scopes of practice and broaden your scopes of practice. So because this has been such like a huge thing in my life, and I'm very passionate about it, we're trying to make sure to spread the word to everybody and give them the skill sets and the education behind it to be able to do so.
Ah, that's so exciting and so cool.
I
I cannot wait to see
know.
all the wonderful things that you are developing and bringing to our community as hygienists. And again, we are so, so thankful that you took the time this morning to come and talk to us and again, give us hope
Thank you
for what
guys.
something can be in the future. So thank you, thank you, thank you.
Thank you so much. It was a pleasure.
Goodness. Sorry, my button's like not wanting to end the
Doesn't
recording.
want to stop.
It
Tabby's
doesn't. It's
button
like, keep
too.
talking. Just keep